Right, so the NHS has limped on to its 75th birthday, limped on being the operative word, given how it's being run into the ground over so many years in recent times. We should be celebrating the milestone. We should be proud, this bastion of socialism, and the proof that it does work, offering free health at point of service, all of us paying for it as a collective society, whether we need it or not, knowing it's there for us all to catch us should we fall, both figuratively and literally. We all have our own stories about how the NHS and how much we value it, what it has done for us all. But now it needs us to act for it if we are to see it survive for another generation. It's 75 years old today. That's a hell of an achievement. But do we love it enough to see it reach 100? Because unless we act accordingly to start actually saving it, it won't. We live in a country with a dominant conservative agenda, not just a conservative party, but Labour along with it these days as well. And for most of its recent history, wedded to neo-liberalism and acting in the interests of the rich, that the NHS is a wasted opportunity to. These people do not need a public health service. They can afford private treatment and would, in order to line their own pockets further, and those of their donors, seek to profit from the opportunities the deep pockets of private healthcare and an insurance-based system would offer. And if you can't afford that yourself, then you can't afford to vote for those that will not protect it. I certainly can't. And I've certainly had plenty of cause to be thankful for that health service over the years. As an unpaid carer as I am, and have been for years now, you might expect that somewhat. But I was born with a cleft lip. I'm sure you'll have seen the Smile Train ads on TV. You might have noticed my top lip not quite being even. There's a little scar here. I had that repaired because we had an NHS that was able to do that. I passed it on to my 3 sons who had theirs repaired too. My daughter was born with spina bifida. She needed spinal surgery, has had years of continuing and ongoing pain and medical support. My wife has fibromyalgia, a poorly understood pain condition, and she also nearly died due to complications with the birth of our youngest child. The NHS saved them both. She was also hospitalised with COVID just last year. Again, she nearly died. Again, I owe the NHS an enormous debt of gratitude. My father, when he was battling cancer, was well looked after both in and out of hospital right up until the end. And my mother, right here and now, having just this very week been formally diagnosed with motor neuron disease and is being looked after by fantastic staff at a local community hospital, which is getting the care she needs. I owe the NHS so much. I owe everything to it. And I'm sure we all have similar stories of what the NHS has done for us all. Yet repeatedly, despite the damage that keeps getting done to it, we don't think of the NHS when we go to vote. For so many of us, it's always been there. The idea that it wouldn't be seems impossible to comprehend, that no government could possibly let it collapse. And yet the story of privatisation in this country shows that is exactly what they are doing. The Tories talk of record funding going into the health service all the time, yet so much of it doesn't actually go into the NHS, just entities that bear the NHS logo, which is not the same thing. Companies that have taken over chunks of it in the name of outsourcing. It's privatisation by another name. And whenever that happens, much of that money, instead of being invested in the service, as was the intention, goes into shareholders' pockets instead. We still get told that this was done, that these NHS reforms were committed to in the name of improving the service, because bringing in private health providers who want a chunk of cash to give to the shareholders will apparently improve matters. But it doesn't. And it's been proven time after time, decade after decade. It just becomes a cash cow to people who want bigger and bigger returns. Look at our water provision. Look at what privatisation has done to that. Look at energy. Look at our recent electric bills and the con that was pulled to see them go up. And you see what privatisation has done there. And the lengths privatisation-centric governments will go to protect it and make it look like it works when actually it fails. Look at the NHS. Look at the likes of Circle or Serco or whoever else has an NHS contract and realise it is costing us, via the public's purse, via public spending, more and more in order to line the pockets of already wealthy people, whilst the service itself ends up floundering regardless of the funding levels. If you think the NHS isn't being privatised by stealth, is not crumbling at the seams, then you just need to listen to a junior doctor or a nurse on strike and ask them, why are you striking? Because so often the case is the first thing they'll tell you is not pay. Because it comes down to underfunding of the service where it is needed, understaffing, an unsafe service that they are struggling to deliver. Those queues of ambulances are not imaginary, you know. And the problem we have now is that both main parties likely to form the next government are singing from the same hymn sheet, not committing to genuinely fixing it. 40 new hospitals when really it turns out to be 5. Successive Tory health secretaries from Andrew Lansley, whose reforms ushered in so much of the privatisation we've seen recently, building on that which was introduced under red Tories like Blair and Brown, followed by Jeremy Hunt, who just carried on with it, who literally wrote a book spelling out how to privatise the NHS, and now with an idiot like Steve Barclay, who when offered extra money to help the NHS by the Treasury, by the government, turned it down, and who would rather take nurses to court to stop them striking than address the reasons that they've actually gone on strike over. The NHS has never and will never be safe in Tory hands, but what a pity, too many just will not value the service enough to vote accordingly. Of course, then you come to Keir Starmer, the leader of the Labour Party, the party who built the NHS, created it, the greatest achievement, bar none, of that party, though Starmer, of course, has gone on record as saying he thinks NATO is. But back in 2020, when he was running to be Labour leader, he said, "My mum was very ill all of her life. And as children and as a family, we spent a lot of time in high dependency units with her in hospital where she was fighting for her life. All I remember her saying to me as a teenage boy once when she was really ill and we were wondering what to do, she took my hand and she said, 'You won't let your dad go private, will you?' And it was really important to her, however ill she was. As a matter of absolute principle, she felt you shouldn't make money from ill health and that it is a matter of principle. It's an absolute matter of principle." And I couldn't agree more with you there, Keith. And I still believe in everything you said back in 2020. The words of your mother, if they were indeed her words, the problem I have is that you don't. You were taking money from people involved in private healthcare, the likes of Trevor Chin, who often gets mentioned. And of course, earlier this year, you were singing a different tune entirely when you were interviewed by Sophie Ridge. Starmer has now said, one of the issues we've looked at is whether or not we're using the private sector effectively. A number of people do go as NHS patients to the private sector. Our research shows that that's been underused and we could do more of it. And that would clear, 230,000 people off the waiting list. Ridge put it to him straight. So more use of the private sector in the NHS under Labour then, to which Starmer answered yes. Principles he talks about. If you don't like these ones, though, he's always got others. Who commissioned that research? Who did it for you? I simply asked because the private sector doesn't have the capacity or the staff required. He's talking nonsense. Our health service is in a bad way. We cannot afford to elect or re-elect the same brand of politics that will carry on wrecking it. That's no birthday present for the NHS. That's not what we all owe it. Those of us who, with stories to tell how the NHS has saved us or saved loved ones, that's certainly not what we owe the next generation who risk entering a world that doesn't have an NHS in it, with the history of what came before it all too well known. At what point do we say enough is enough and stand by our NHS and do our part to save it, to show it some gratitude and some respect? It belongs to us all, after all. When will we stop letting governments take these things away from us and hand them over for vultures to pick the bones clean off? And after you've liked, shared and subscribed to the channel, as I sincerely hope you will, if you appreciated this video, here's a recommendation for you. Stick around on the channel a bit more, where the MPs linked to being on the take from private healthcare donations are being named and shamed. Again, with Labour often being no better than the Tories, not least because of the people from Keir Starmer himself to his shadow health team getting outed by them. And I'll catch you on the next video. Cheers, folks.